Ladies and gentlemen, angry Americans around the country and around the globe, it's go time. The election is here. COVID is hitting people nationwide, and we're going to continue to bring important, inspiring, iconic, informative guests that can help you sort through it. And on very short notice, I am very, very happy and humbled to have joining us today the great and powerful Dr. Vin Gupta. Welcome to Angry Americans, sir. Great to have you here.
No, what a pleasure, Paul. Thanks for having me. Really, such a treat.
Well, and I got to kick it off by saying, you're on TV a lot. I think you're a voice of reason. I think you've been heroic and so helpful just to the American people. I think it's a tremendous public service what you've been doing. You're inspiring. I think you're bringing people great information, but also comfort. And your personal story is incredibly inspiring. Folks are getting used to seeing you on TV, but for those who are watching and not listening, they don't usually get to see that background. So can you tell me, this is kind of the cool background. I like this. What do you got? What do you got behind you?
Yeah, this is my my work office. So it's a combination of, some of my favorite books. I got this a great picture of a few or a sculpture of Indian goddesses back in Bali, where my wife and I actually met, kind of strangely enough, when I was out in Asia way back when doing epidemiology work, and she was doing acupuncture work. And so we were traveling through Indonesia and spent some time in Bali. So that's from Bali. Some favorite reading materials here: The Great Influenza, very pertinent, highly recommended, from John Barry. And then, just a picture of family. And then just to make sure you think I'm, that I'm legit, some medical credentials up there. So a little combination of.
I love it. It's very cool. Over your left shoulder, I was trying to figure out what that was. I thought it was a framed horseshoe crab. Because I was like, this is mysterious and amazing. So that's really cool. Let me ask you this, sir. Willie Geist put us in touch. He's been a regular guest on the show. We have a lot of friends in common, General Mark Hertling and others. A lot of folks don't know that you are still serving in the Air Force Reserve. I want to get into that, but let me ask you a question that I've been asking everybody since the pandemic started, because people see you on TV, but they don't always get a true sense. Where are you, and how are you? How are you and the people around you, dealing with all of this and everything happening right now?
Paul, thank you for just the opportunity. I'm physically right now in Seattle, Washington, not far from the University of Washington, where I continue to have a research scientist role at the Institute for Health Metrics. They've been developing those models that none of us really want to believe, but unfortunately are all too true. And we're, my wife's a pediatrician, and we've been experiencing the pandemic through so many different lenses, just like all Americans are right now. We're scared. We want to see our loved ones. We want to see our friends. We love eating out. We want to do the things that we love to travel. All the things that I know all of us are craving to do. We're exhausted by the same, by everything that we're all exhausted by. We too share that exhaustion, which makes it hard, because when you go out and when I'm talking to Willie, or when I'm talking on and have the privilege of having a mini platform talking to Americans, I don't necessarily love what's coming out of my mouth. I don't like that I have to be that messenger, but I recognize that we're in a unique time in history, and that some of us, circumstance has conspired to give us this privileged platform to speak truth to the American people, and I try to be responsible with it.
Mm. Yeah, I think you've done such a great job of being candid. I mean, you're no bullshit. When you come on TV, people know they can get, the real deal from you. And as a military veteran, I especially appreciate that, because there are so many similarities, in my view, to the pandemic and a combat environment, the uncertainty, the importance of good information, the critical role of teamwork. There's a lot of it. You're also in a position where you're personally experiencing the pandemic. You're covering and working in the pandemic, and you're also trying to positively influence it. So that's a really unique leadership role to be in that I don't think everyone can understand. We deal with it in a lot of ways. I want to get to know a little bit more about you, the stuff we don't get to see on NBC. The question we ask of all of our guests: if you ever take a break, which I don't know if you've taken a break in the last 8 months, and you have a cocktail or a drink with your wife or whoever, what is your cocktail or adult beverage of choice?
I am a one-trick pony here. I'm a big fan of the type of red wine where at the bottom of that bottle there's soil, there's sediment. So like that violet colored deep pink or deep red uh, Cabernet or you name it, where there's soil at the bottom. I love that, and I just not that I don't love. My wife's a big margarita fan. We love our mixed drinks. Or I love a gin martini every once in a while. Of course, Pacific Northwest, incredible beers. But if you had to pin me, a great bottle of red, a deep red, like heavy and just like dries your mouth out. That's how I relax at the end of the day.
Love it. I think America owes you a lot of cases of wine after what you've been doing for the last couple of months.
I won't say no. I won't say no.
You've got a really incredible resume and incredible career. You've done a lot of things. I mean, you're, working at Amazon, you're in the Air Force Reserves, you're on NBC, you're probably, I assume, seeing patients. You're in a lot of different worlds, but take us in the way back machine. Dr. Gupta, when you were growing up, what was your first car?
My first car was the car I had dreamed to own, which is a Honda Prelude 2001 black, two-door. And I know Preludes, I don't know if they're even something you can buy anymore, but they're sort of like the sporty yet affordable version of a Honda Accord. Man, I miss that car.
I like it. It feels like it would fit that backdrop. And it's sleek and practical, and not dissimilar from you, right? But let me ask you to kick it off in a different way. This is a very trying time for people. I feel like this week edges are starting to get frayed, right? We've been talking a lot in this show about the storms that are coming, and the election is one of them. The pandemic storms kind of hit like hurricanes, and maybe that's one way of looking at them. And you talk a lot about the current state of affairs. Can you break down for us in your no shit way, not just where we are, but what's to come, right? You're a major in the Air Force Reserves. If I came in and said, hey, I'm the 4-star, brief me on how you think this battlefield's gonna unfold over the next couple of months, and understanding the situations on the ground are gonna change. Can we start off with an assessment from you on what you think is to come?
You bet, Paul, and just for your listeners and your viewers out there, to give them a sense of where I'm coming from. Let me just quickly step back and say, my lenses to the pandemic have been the following. I attend in our ICUs here in Seattle, and/or I'm clinical with the Air Force Reserve as an ICU doc, as our critical care transport team, which is an incredible capability. I'll talk about that in a second. For about a week a month, usually nights and weekends. At Amazon, I was brought on to be their sort of chief or senior medical officer, guiding their COVID response to keep their fulfillment centers safe and healthy, so they could deliver diapers to mom and get needed services to grandma. So it's a role I take really seriously, because I think without an Amazon, what do you get? I mean, people are really relying on these types of companies. So that's given me interesting perspectives as well. And then, of course, what we're doing over at IHME and at the University of Washington in terms of modeling from a research scientist standpoint, that's what informs what I say on the air. So what I say on the air, I'm again, privileged opportunity to do it, but it's informed from real lived experience through a variety of lenses. What I will say then, from what I've seen in the private sector, the public sector, and on the wards, is the following. We do not have the right type of resources available to the majority of Americans to keep us all safe. So what do I mean by that? We have 80,000 new cases a day, Paul. 80,000. Hospitalizations are peaking now in ways they haven't peaked in the entire pandemic in 39 states. We're seeing field hospitals, U.S. Corps of Army Engineers, other military assets, National Guard, for example, are building field hospitals in places like Utah and Wisconsin. That's not normal. I just got disaster credentials for to go serve as an ICU doc on a 7 to 10 day mission in South Dakota for the Indian Health Service. This is not normal. This is not to be expected. This is not rounding the curve. So let's be clear here. This is high, and we're still. I mean, in Seattle, it's still about 60 degrees Fahrenheit. It's not that cold. It's not that cold right now in the majority of the country, and we're already in a really bad spot. So this is going to get, regardless of who's leading the country, this is going to get bad going into December, January, February. It's going to get bad. We're at IHME forecasting about 2,500 deaths a day at the worst of it starting Jan 1. And I think that's unavoidable. I think we need to understand, how do we mitigate the loss of life at this point? That's where we're at. We're in the midst of a disaster. It's evolving. And we really need to re-index our response here. Because right now, it is 50 different approaches in 50 different states, and we just cannot have that. And I'm happy to go into what I mean by that, what we need, but we are in a very precarious spot right now. There's no doubt about it.
Can I ask you to build on that? I feel like we're in a spot where we had kind of a first bombing wave, okay? And we got hit and everybody kind of poked their head up and said, okay, I didn't get hit. I'm coming out now, right? And then we had these smaller bombing waves. And now, to stretch the military comparison, the full-scale ground assault is coming. And it's coming in all areas from all sides. We obviously didn't have the resources. We also, in my view, didn't have the leadership and didn't have the strategy. You bring up an important point about it doesn't matter who wins, this month. We're still going to have this reality that must be faced. The invasion is still going to keep coming, and the response can largely be driven in one way or another by who the leader is. But what does that mean for average people, right? You're also a dad, you're a family man. I'm telling my family, schools, if they're not closed, they're going to be closed soon. We may have a lockdown of some kind if it's not at the state level, at the national level. Resources you're already identifying are more scarce. What does it look like for the individual, and really as a doctor or to your family members? What do you recommend that people do to prepare for that reality? I went today and got my kids' flu shots. Yesterday, I got my dental work knocked out. Like, I'm trying to think about what are the priorities for me and my family. Can you bring it down to a personal level, assuming that the people listening wear masks, social distance, wash their hands, they do all the right things? How can they prepare for that very difficult reality to come?
Paul, there are no easy answers here. This is the top level. This is what I would say, number one, because I think people don't know what to ask for. But that's what I've realized. People don't know what are they entitled to as an American? What should they reasonably expect from their government? And it's reasonable to expect that everybody should be able to test themselves for COVID-19, not just once a month or once a week, but when they want to be tested. Because what we realized here, you saw this, after the president turned out positive, how many times did he get retested? How many times did his close contacts get retested? It wasn't a spot check. Everybody was suggesting it needed to be multiple times in the week ahead because it takes time for COVID-19 to incubate in the body. And what are we saying? We're basically saying, well, if we get a test for the longest time now, it's been, well, we need to get every American a test. What about follow-up testing, especially after a close contact, or if you want to go home for Thanksgiving? What about testing on the front and the back end, not just one time, but a few times? That's what people need. So it's on, as your listeners and viewers go to the ballot box, you should have a government in place that prioritizes home testing. We are at that place now where pandemics are a reality. We've had 4 epidemics of pandemic potential just since 2014, and this has been the big one. This is not going away. This threat's always going to be there. So we need a forward-thinking government that says, how do I get testing in the hands of Americans? It's not that hard. So Americans should expect that, number one. Number two, I am tired of people coming to me desperate for knowledge on what type of mask they should wear, and then my response being, well, a 3-ply surgical or a cloth mask. No, that's not right. People deserve, especially on the West Coast here where there's smoke, there's wildfire smoke for up to 3 months out of every year, people deserve the highest quality masks if they want one. And we can't say, well, we don't have enough. We're still supply constrained, just like we're supply constrained with our home testing apparatus. No, people should expect these things from their government. Threats have evolved and our response needs to adapt itself accordingly. So as you go to the ballot boxes, you think about what you deserve as an American. You deserve access to frequent testing at home. There's no reason why we can't do it. Massive public health education campaigns and strategic investments can get us there and get us there safely. And number two, everybody deserves an N95 if they want one. And what I hear sometimes critics, my colleague, even professional colleagues say, well, then that's not realistic. Well, why isn't it realistic? We went to the moon. We can't fit people with an N95 mask. Really? Are we saying that? So that's high level. We don't have the resources to keep everybody safe. It's either if you're rich or if you happen to be an ICU doc, oh, well, I can get these resources if I want to keep myself and my family safe. But that's not fair. It should not be the haves and the have-nots. That is wrong. So that's number one. Paul, what I would say here is I've been thinking about holiday travel. People ask me, well, hey, doc, is it okay to get on a flight? You know, here's the truth. A flight is actually, I'd rather be in an airplane than in an indoor classroom. Mask distance, maybe eye shields. But I mean, the truth here is you have air exchanges every 8 to 10 minutes. So flights are maybe not totally unsafe, but would it be better if people decided to stay home and try, especially with the worst of it ahead of us? I would recommend probably being very strategic on any type of holiday travel. We could talk about that more if you'd like. When it comes to in-person schooling, I hate that schools are open without testing. It makes no sense that we have schools open across the country and those schools can only test if they're rich enough to test because they're located in an affluent area. That's wrong. So if I was a parent of a child and there was not frequent testing or the ability to test at least weekly in place, and I was vulnerable as a parent, or if you have older loved ones at home, I would definitely think twice about sending your kid back to school with the worst of it ahead of us. And common things being common, vaccinations, hand sanitize. I mean, all the things that we're already doing. That's the best we can do right now with the resources we have.
I appreciate that because I think, you've been great about laying out the policy and also bringing it down to the personal level. I think on the policy side, there may be differing views on this. I don't count on a federal response anytime soon, right? No matter who wins, looks like Q4 is going to be nuts. Then best case scenario, in my view, Joe Biden gets elected. And in January, he starts to move forward what we probably should have done a year and a half ago on everything from testing to financial responses. But what I'm looking at now is a landscape where we really don't get the help we need until best case scenario Q1 of next year, late Q1 of next year. And in the meantime, folks are going to be looking at their television to you and others saying, should we really have Thanksgiving or not? Right? Should I send my kids to school or not? So those specific answers, I think, are really, really helpful and refreshing. Can I ask you to even take it down a step further? People who are thinking about dental care, seeing their doctor, pediatricians visits. I mean, I went in this morning and I can feel the stress in the family office where, nurses are doing flu shots and people are walking in with all kinds of stuff. What are you going to do for you and your family between now and January that other people could learn from and replicate? Because frankly, you're leading by example when our president and others aren't.
No, Paul, absolutely. This is what we know about going to the doctors or to the dentist's office, that these places where stringent mitigation protocols are placed. What does mitigation mean? Whenever you hear the term mitigation, it means distancing, masking, sanitizing. That's what we talk about when sometimes public health officials use the word mitigation. When those procedures and policies are in place and usually really well implemented in healthcare settings. So I would definitely not defer needed care and needed screenings for anybody, because we're worried actually about deferred care. People are not getting their cancer screening. They're not going to the dentist for their annual screening. And it's causing a whole ton of other issues because of the pandemic. No, I think it's actually quite safe to go, because if you're following what the guidelines are saying and what are posted on these clinics, you should be just fine. So I personally have done, I just took my 3-year-old to see his pediatrician in person to get a flu shot, and I'm glad I did it. And I think you're at no increased risk as long as you're doing all the things that you should be doing. So that's number one. On holiday travel, I'm of two minds on this. And this is where I think this is important for us to just level with the American people.
Yeah.
I went home to see my folks. My mom's in her mid-70s. over Labor Day weekend. And I knew it was my probably last chance to do it before things got bad. I'm glad I did it. And I knew that if I was going to do it, I was on a level with folks that I did it. This is how I did it. I wore an N95 that I recycled from an ICU shift on the front end, on the back end. 72 hours before I got on my flight, I basically quarantined in place with my wife and my son. I didn't go out and do anything that I didn't need to do. And then I tested myself with a rapid test that I had privileged access to because I'm a doc. I've been in my various roles. I've been vetting these technologies. I'm being very honest. I have access to things that most people do not have access to. N95 and a rapid test right before I got on the flight. It was negative. I went on a flight. It was Delta. They were appropriately keeping the middle seat open. And then on the back end, when I got home, I was only home for a week. I masked for 72 hours in front of my folks. And then I tested myself. And so and I posted on this on Twitter and it got some traction. I said, if you can do that, go home.
Right.
But if you cannot do that, that's the bar, because the last thing you want to do, Paul, is the last thing you want to do is go visit your folks and expose them to COVID-19 and then regret it for the rest of your life. Yeah. I'm not saying it's going to happen, but there's a chance it could. And so
I think you're leveling with people in a way that they need to hear. You know, I've tried to explain to my family, and I'm no medical expert, but look, every time you go outside the wire, you're at risk. Every time you leave the house, sometimes you're wearing your body armor, sometimes you're not. Sometimes you're walking through a firefight. Sometimes it's a safe and open field. Like Cracker Barrel, with no mask on, sitting at the counter is a whole lot different than riding on Delta with an N95 after you've been tested. So I think it's about getting that ground truth reality. But I want to ask you, Dr. Gupta, the question we ask all of our guests, and you're great at channeling positive, righteous anger into positive impact. That's a theme of this show. If you're not angry, you're not paying attention. But I want to ask you, you feel things. And I think that's part of why people respect you, because you have the clinical perspective, but also an emotional, visceral connection with what's happening. So Dr. Gupta, what makes you angry?
You know what makes me angry, Paul, is, and I've thought a lot about this through the military lens, but it's the individuals that are currently making decisions, whether previously, let's say in response to 9/11, it was an elected official who's never worn the uniform, deploying someone else's son or daughter. Here, it's the same paradigm. It's somebody who doesn't know a darn thing about healthcare or never cared for a patient, much less a COVID patient, making life and death decisions when it comes to our public health system and how to allocate resources. That's what makes me angry, that we have such an epidemic of adverse selection in our politics, that we have fundamentally, we have the wrong leaders, not just for this moment, but for all moments of crisis. But that's what makes me angry, that we have to sit here and have these ridiculous conversations with a seeming basic common sense because the people that have power have hung on to power because our politics is all messed up. You know, I don't think we're a true representative democracy, unfortunately. Because of that, we're having these ridiculous conversations. Versus if we had the right people in power, if it was a merit-based system, we would be having a much different conversation. But we're having to have the conversations. I'm having to go on TV. Others have been having to go on TV saying the most basic things. It actually makes me feel ill sometimes that am I literally saying the same thing over and over again? Why am I saying this? Is this a good use of time? The only reason why is because we have the wrong people largely. I'm not saying everybody, but many wrong people in the halls of power. And there are a lot of reasons for that. That makes me angry.
I appreciate that. I mean, we have a command climate that is in direct conflict with science and experience, right? Like the president, the commander in chief, he knows, as much about frontline healthcare work as he does about Vietnam. I mean, it's a similar situation. We got a secretary of education who's never been a teacher. I mean, there's a lack of ground truth perspective, but you touched on a couple of the military themes. I want to ask you specifically, it's something we've covered on this show, I think is the most underreported part of the pandemic, is how many veterans have died. We don't know how many have died, but it could be as many as 1/4 or 20% of all of these old folks that are dying could be World War II veterans. The VA, in my view, has not done a good job of testing. They've only tested just over 800,000 people since the pandemic began. I think New York State does that in a week. So in my view, there's been a flat-footed response by the VA and the DOD. but it's also endangered our national security, right? Our enemies celebrate when you have to take a destroyer offline, or the 82nd Airborne have to take a unit and hold them. People can't rotate home for the holidays. You have a really unique perspective on this as a nationally recognized doc, but also as an Air Force reservist who's still drilling. Can you break down how has COVID hit our military and how have they responded?
You bet, Paul. I mean, from the lenses that I have, which is the Air Force side, the medical corps, and then from the conversations I've had, for example, with the Marine Corps, there's two issues at play. There's force protection. How do we keep our forces safe? And there's a lot of complicated questions to be answered. And then what do we do with our vets? And how do we make sure that they're cared for when they're historically under cared for? Because the big issue, and then you reference this, and the numbers you cite, actually, again, I mentioned this to you earlier, I haven't been tracking that story because it hasn't gotten a lot of press. And I feel bad that I, as somebody that's a service member, was not aware that our testing for our veterans has been lagging to that degree. It doesn't surprise me because we know veterans in general are a neglected cohort of individuals. They have a terrible access to primary health care, waiting. I mean, we saw the saga of just a few years ago and the crisis at the VA. So this speaks to a broader theme that if you don't have durable access to timely health care, of course you're going to be bearing the brunt of a bad outcome from a once in a century pandemic. So it does not, veterans in general are a vulnerable group. We know that, just like people of color. And it does not surprise me that they are now feeling the brunt of this. So that's number one. Number two, on force protection, one of the challenges here, and Paul, you know this, is there is a checklist that's endless, that's nauseating in some ways before one were to get deployed. And a lot of that is focused on, are you green in the system from a medical checklist standpoint? One of the complicating factors here, half my unit's going to deploy over to Al Udeid at the beginning of the year. They have to do 2 weeks of mandatory quarantining before here in the U.S. out in Jersey before they go out to Al Udeid. And 2 weeks, that's 2 weeks in the continental United States when they could be with their family, but now unfortunately now they have to be at McGuire. So that's number one. 2 weeks is a lot, but 2 weeks is also quite the burden on our forces because we have a limited number of active duty and reservist force that can be deployed, number one. And then you're basically saying everybody needs a blanket 2-week quarantine, even if they're asymptomatic, before you send them on, you test them and then you send them on their way. So we're trying to think of creative solutions. I was just part of a conversation with the Corps, the Marine Corps, about how can we actually reduce that quarantining time to keep cadets healthy, to keep our deployed forces safe and healthy, but also to increase movement, mobility, and to get people in and out of their deployment rotation quickly so that there's less stress. Those are really challenging questions, but we're working on them as we speak. But I will say, I think the military, at least on the force protection side, is asking the right questions, and they're trying to build a surveillance infrastructure in place that keeps everybody healthy and minimizes these logistical complications.
I'm glad you touched on that because this week we found out that the number 2 at the Space Force is tested positive for COVID. At one point, the entire Joint Chiefs were in isolation, were quarantining because of exposure. So there's a real impact on the movement of our people. We can't move and do the things we wanted to do. And as you spin up National Guard troops in response to potential election unrest, the pandemic, I don't think they have standardized testing across all the National Guard either. I mean, when we deployed to Iraq, I had guys who hadn't seen a dentist in a year. Some of these guys and gals are going to get deployed by the National Guard and they haven't been tested either. So there's a long tail of that I think is deeply concerning to me, and I think our enemies are going to relish. Doc, you're a positive guy. Despite all this, you bring great energy, you inspire people. You're one of those rare people that you can watch on television and leave feeling better than worse, right? You feel like this was worth my time. You continue to be, I think, a real voice of reason for this country. So let me ask you, Dr. Gupta, what makes you happy?
Gosh, thank you for letting me brood on that a little bit. I think more than anything, what makes me really happy, actually, being in Seattle this might not be what the answer you expected, but my son has really gotten into aviation. I'm an Air Force guy. So we've been spending much of I don't know if you've ever been out to Seattle, but the Museum of Flight out that Boeing and others have built. A lot of it's outdoors actually. Is our happy spot during the pandemic. So it's we and my wife kind of tolerates it, but she's a little less interested in that space. But we've been doing World War I, World War II aviation sort of history tours, going and boarding Lyndon B. Johnson's Air Force One. They have it kind of in this outdoor tarmac area. That's what makes me happy, time with family, but doing things that I know my son and the next generation are kind of have their eye out on. In his case, it's aviation and astronomy. So it's just that's an example of what makes me happy is actually just time with family and being the dad and learning to be, I guess, the best dad I can be.
I think I appreciate that, especially. I got two little guys and their interest in aviation and NASA and all things space and aviation is really, really incredible. And Seattle's got some of the best museums. My favorite museum maybe in the country was the Experience Music Project, the Music Museum, and then the Sci-Fi Museum is downstairs, which is really just cool, right? Some of the coolest, most interactive museums. Let me ask you another question, Doc. People are watching you. They're inspired by you. You're a voice of reason. You're doing many things. Would you ever run for office yourself? Because I think you're the kind of person we want in government right now, and we need competence and no shit from leaders. Would you ever run for office yourself?
I guess I'm not going to do what I think most people, what I've seen current politicians do, which is say one thing, but actually they internally mean something else. Yes, absolutely. Why not? And I think if I'm calling them out, I should be willing to do it myself. And so I think folks like yourself, Paul, people who've served, nurses, other frontline health staff, these are the types of people we should want in elected office. And so if I've long thought, I'm from Ohio, my wife and I met in Toledo. I've long thought about going back home. I was Rich Cordray's health policy advisor when he ran for governor in 2018. I sad when he didn't win. I thought he would have been an excellent leader for my home state. It's where my folks, my in-laws still live. I think we have a crisis of democracy, and in part because we don't actually have people who are public servants before they pretend to be public servants in the halls of power. And so yes, of course, I absolutely have thought about it. I think there's the dark underbelly of exposure, which I've been exposed to now in my role as a national commentator for COVID-19. I've seen the dark underbelly, and I've made it. So yes, absolutely, why not?
I love it. Can you run for mayor of New York City, please? Because there are a lot of positions in government where we need someone who can address what I think is going to be the fight of our time right now, which is the pandemic. I mean, I think this is the call of our generation. We're going to need leaders in the same way we needed leaders who served in Iraq and Afghanistan to come back and help shape, our combat operations. We need frontline first responders. It's first responders day was this week. We need those people with experience on the front lines of this pandemic, future pandemics. So, I'm happy to start the draft Vin Gupta campaign going forward. I want to. I got to let you go and get back to a million things. You mentioned your son. Halloween is this week. Do you have a Halloween costume? What's Dr. Vin Gupta dressing up as for Halloween?
Oh gosh.
An exhausted doctor? Other than that?
Yeah, exactly. I don't have one yet, but we are dressing up our 20-pound cocker poodle mix and our 3-year-old son Aiden in tacos. So they're going to be in taco shells. So I guess maybe I'll get one for myself. But
that's outstanding. I hope you wear it on Morning Joe. I think that would be fantastic. I think I really wanted to have a conversation with somebody this week that could help us understand bigger than the election, right? Like everybody's talking about the election. We've tried to be about what's next. And I think that you have really helped us do that. You continue to do that for our country. I am exceptionally grateful. Normally we would do this in person. We can't do that. So I need to present you with some gifts, if that's all right. You're a very well-dressed man and a man of style. So I'm going to send you some Angry Americans gear. Made by
Awesome.
the veterans of Oscar Mike. You can rock that. If you don't have a Halloween costume, you can be an angry American. I'm going to send you, I know you like wine, until we get a wine sponsor,
There we
Uncle
go.
Nearest 1884, the best American whiskey out there. So I hope you
Love
can
that.
enjoy that at some point if you ever get a break. And then
Thank you.
the last gift that's also a question, kind of a Rorschach test of this show, is we have 3 colors of Peeps: yellow, pink, and blue. Dr. Vin Gupta, which color would you choose and why?
Blue, because it reminds me of blue sky, and we don't have nearly enough of that right now in Seattle.
I love it. I love it. The Air Force guy says the blue sky. We need blue skies, and we got to have hope for the future. Dr. Vin Gupta, you give us that every day. Thank you for your leadership. Leadership's about sacrifice, and I know, I can't even imagine how many times you've had to step away from your family, leave your 3-year-old and go out and try to inform the American people. You're a hero, man, and you're saving lives. And on behalf of the entire country of all backgrounds, I want to thank you for your leadership and sacrifice, and tell you, our reward is we're going to ask you to do a whole lot more of it in the months ahead.
Thank you, Paul. Thank you for having me and for the invitation. What an honor. Such a great chance to meet you.
Thank you, sir. Keep after it. We're rooting for you, and wherever you are, stay frosty.
Thanks, sir.
Thank you, sir.